Open your mouth and look at your tongue right now. What you're seeing isn't just a muscle for tasting food and speaking. Your tongue is a remarkable diagnostic window into your entire body's health. For thousands of years, traditional medicine recognized this. Today, modern medical science confirms it with sophisticated research. Your tongue contains over 10,000 taste buds, dense networks of blood vessels, lymphatic tissue, and nerve endings connected to virtually every major organ system. Changes in your tongue's appearance, texture, color, and coating can reveal vitamin deficiencies, infections, autoimmune diseases, cancers, and organ failures long before other symptoms appear. I'm going to reveal 7 critical tongue signs that experienced clinicians check during every physical examination. Some of these signs can detect life-threatening conditions months or even years before conventional symptoms develop. By the end of this video, you'll know exactly what to look for and when these changes demand immediate medical attention. Geographic tongue, the mysterious map pattern. Let's start with one of the most visually distinctive conditions, geographic tongue, medically termed benign migratory glossitis. Imagine your tongue surface covered with irregular map-like patches. These patches have smooth red areas surrounded by white or yellowish borders. The pattern constantly changes, with patches disappearing in one location and appearing elsewhere over days or weeks, hence the term migratory. Here's the fascinating pathophysiology. Geographic tongue results from loss of filiform papilla, the tiny finger-like projections that give your tongue its rough texture. When these papilla desquamate or shed prematurely, they expose the underlying red, inflamed mucosa. While geographic tongue is usually benign, recent research published in the Journal of the American Academy of Dermatology reveals important associations. Studies show that 40% of patients with geographic tongue have psoriasis or develop it later in life. The connection lies in both being inflammatory conditions involving abnormal keratinocyte proliferation. Additionally, geographic tongue correlates strongly with fissured tongue, also called scrotal tongue, characterized by deep grooves. Together, these conditions suggest underlying inflammatory processes, possible celiac disease, or reactive arthritis, particularly when accompanied by joint pain or digestive symptoms. Most importantly, geographic tongue can indicate nutritional deficiencies, especially zinc, B vitamins, particularly B12 and folate, and iron. These deficiencies impair normal papilla regeneration, triggering the characteristic patchy appearance. If you notice map-like patterns on your tongue, especially with burning sensations when eating acidic or spicy foods, document the pattern with photographs and consult your physician. Request complete blood count, comprehensive metabolic panel, and vitamin level assessments to exclude underlying deficiencies or systemic conditions. Black hairy tongue, more than just alarming appearance. Now let's discuss one of the most visually disturbing tongue conditions, black hairy tongue, or lingua villosa nigra. This condition looks exactly as it sounds. Your tongue develops a dark, hairy appearance that can range from yellowish-brown to completely black. The mechanism is fascinating and involves the filiform papilla we discussed earlier. Normally, these papilla shed regularly through a process called desquamation. However, certain conditions cause the papilla to elongate dramatically, sometimes reaching 15 millimeters in length compared to their normal 1 millimeter. These elongated papilla trap bacteria, food debris, tobacco particles, and dead cells. Chromogenic bacteria, particularly species like Prevotella and Porphyromonas, colonize these elongated papilla and produce pigments ranging from yellow to brown to black, creating the characteristic discoloration. But here's what many people don't realize. Black hairy tongue isn't merely cosmetic. It serves as a warning sign for several serious conditions. First, it commonly develops after antibiotic therapy, particularly with tetracycline, erythromycin, or broad-spectrum antibiotics. These medications disrupt your oral microbiome, allowing chromogenic bacteria to overgrow unchecked. If you develop black hairy tongue during or after antibiotics, it indicates significant oral dysbiosis requiring intervention. Second, black hairy tongue strongly correlates with gastroesophageal reflux disease, or GERD. Stomach acid repeatedly bathing your tongue alters its pH and tissue composition, promoting papilla elongation and bacterial overgrowth. Multiple studies demonstrate that treating underlying GERD often resolves black hairy tongue completely. Third, this condition frequently appears in patients with diabetes mellitus, particularly those with poor glycemic control. Elevated blood glucose creates an oral environment favorable for bacterial and fungal overgrowth. Black hairy tongue in diabetic patients often indicates inadequate disease management. Fourth, heavy smoking and excessive coffee consumption contribute significantly. Both contain compounds that stain elongated papilla and alter oral pH. Most concerning, recent research links black hairy tongue to increased risk of oral candidiasis and potentially oral cancer, especially in smokers. The altered oral microbiome and chronic inflammation create an environment conducive to dysplastic changes. If you develop black hairy tongue, don't dismiss it as merely cosmetic. Address underlying causes, improve oral hygiene, use a tongue scraper, treat GERD, control diabetes, reduce smoking and coffee intake. If it persists beyond 2 weeks despite interventions, seek medical evaluation to exclude more serious pathology. Smooth, red, painful tongue. The vitamin deficiency warning. A healthy tongue should have a slightly rough texture from papillae and a pink color. But if your tongue becomes abnormally smooth, glossy, and intensely red, often with burning pain, you're looking at glossitis, which signals potentially serious nutritional deficiencies. The medical term is atrophic glossitis, and it results from complete loss of filiform and sometimes fungiform papillae. Your tongue literally loses its normal architecture, becoming smooth like polished leather. This isn't a cosmetic change. It reflects profound cellular dysfunction affecting your tongue's mucosal lining. The most common cause is vitamin B12 deficiency, also called cobalamin deficiency. Vitamin B12 is essential for DNA synthesis and cellular replication. Rapidly dividing cells, like those in your oral mucosa, are particularly vulnerable to B12 deficiency. Without adequate B12, these cells cannot regenerate normally, leading to papillae atrophy. But B12 deficiency doesn't occur in isolation. It typically indicates pernicious anemia, an autoimmune condition where antibodies attack gastric parietal cells, preventing intrinsic factor production. Without intrinsic factor, you cannot absorb B12 from your diet regardless of intake. Here's the critical point. Glossitis from B12 deficiency often precedes neurological symptoms by months or years. These neurological manifestations include peripheral neuropathy with numbness and tingling in hands and feet, loss of proprioception, ataxia, cognitive impairment, and, in severe cases, subacute combined degeneration of the spinal cord, which can become irreversible. Your tongue is giving you an early warning. If you catch B12 deficiency at the glossitis stage and initiate B12 supplementation, you can prevent devastating neurological complications. Atrophic glossitis can also indicate folate deficiency, which causes megaloblastic anemia similar to B12 deficiency. Folate is crucial for DNA synthesis and red blood cell formation. Deficiency often results from adequate dietary intake, malabsorption from celiac disease or Crohn's disease, or medications like methotrexate. Additionally, iron deficiency causes glossitis, frequently as part of Plummer-Vinson syndrome, characterized by the triad of iron deficiency anemia, glossitis, and esophageal webs. This syndrome significantly increases risk for oral and esophageal cancers. Niacin deficiency, or pellagra, causes glossitis as part of its classic triad: dermatitis, diarrhea, and dementia. While rare in developed countries, pellagra still occurs in alcoholics, patients with malabsorption syndromes, and those with carcinoid tumors. If you notice your tongue becoming smooth, red, and painful, especially with burning sensations when eating, request comprehensive testing. Complete blood count, serum B12, folate, iron studies including ferritin and homocysteine and methylmalonic acid levels to confirm B12 deficiency. Early detection and treatment prevent irreversible complications. White patches that won't scrape off, leukoplakia warning. Now we need to discuss a tongue finding that demands immediate medical evaluation. Leukoplakia, characterized by white patches or plaques on your tongue that cannot be scraped off and don't resolve within 2 weeks. Leukoplakia represents abnormal keratinization of the oral mucosa. Essentially, cells in your tongue's epithelial layer undergo hyperkeratosis, producing excessive keratin similar to calluses on your feet. These white patches can appear anywhere on your tongue, but commonly affect the lateral borders and undersurface. Here's why leukoplakia is so concerning. It represents a pre-malignant condition. Approximately 5 to 17% of leukoplakia lesions undergo malignant transformation into squamous cell carcinoma within 10 years. Certain subtypes carry even higher risk. Erythroleukoplakia, displaying mixed red and white patches, has malignant transformation rates exceeding 30%. The red areas represent dysplastic epithelium with increased vascularity, indicating more aggressive cellular changes. Proliferative varicosa leukoplakia, a particularly aggressive variant, shows warty, multifocal white lesions with extraordinarily high malignant potential. Studies report transformation rates approaching 70% over time. What causes leukoplakia? The primary risk factors are smoking and smokeless tobacco use. Chronic irritation from tobacco triggers cellular changes, leading to hyperkeratosis and eventually dysplasia. The longer you use tobacco, the higher your risk. Chronic alcohol consumption, particularly when combined with smoking, dramatically increases risk through synergistic effects. Alcohol acts as a solvent, enhancing carcinogen penetration into oral tissues. Human papillomavirus, particularly high-risk strains like HPV-16 and HPV-18, also causes oral leukoplakia. These same viral strains cause cervical cancer and oropharyngeal cancers. HPV-associated leukoplakia has significant malignant potential. Chronic mechanical irritation from sharp tooth edges, ill-fitting dentures, or habitual cheek biting can trigger leukoplakia. While less concerning than tobacco-related lesions, these still require monitoring. Importantly, you must distinguish leukoplakia from oral thrush or candidiasis, which produces white patches that easily scrape off, leaving red, bleeding areas underneath. Candidiasis results from fungal overgrowth, commonly in immunocompromised patients, diabetics, or those using inhaled corticosteroids or antibiotics. If you notice white patches on your tongue that persist beyond 2 weeks and don't scrape off easily, seek immediate evaluation from an oral surgeon or otolaryngologist. The gold standard diagnostic approach involves biopsy, with histopathological examination to assess for dysplasia. Treatment depends on biopsy results. Lesions showing mild dysplasia require close monitoring. Moderate to severe dysplasia demands surgical excision because malignant transformation risk is unacceptably high. Don't delay. Early intervention prevents progression to invasive carcinoma. Bright red, strawberry-like tongue, infection and toxin indicators. A bright red tongue with prominent enlarged papillae resembling a strawberry signals specific infectious and toxin-related conditions requiring urgent treatment. The most classic cause is scarlet fever, a bacterial infection caused by group A Streptococcus pyogenes producing erythrogenic toxins. Scarlet fever initially causes white strawberry tongue, where the tongue is coated white with red papillae protruding through. After several days, the coating sheds, revealing red strawberry tongue, characterized by bright red coloration with prominent papillae. Scarlet fever requires immediate antibiotic therapy, typically penicillin or amoxicillin, to prevent serious complications, including rheumatic fever, which damages heart valves, and post-streptococcal glomerulonephritis, causing kidney damage. Kawasaki disease, a serious vasculitis affecting children under 5, prominently features strawberry tongue as part of its diagnostic criteria. Kawasaki disease causes inflammation of medium-sized blood vessels throughout the body, particularly coronary arteries. Without treatment, approximately 25% of affected children develop coronary artery aneurysms, which can lead to myocardial infarction and sudden death. Diagnosis requires fever lasting 5 days plus 4 of 5 criteria: bilateral conjunctival injection, oral mucosa changes including strawberry tongue, polymorphous rash, extremity changes with erythema and edema, and cervical lymphadenopathy. Treatment involves high-dose intravenous immunoglobulin and aspirin to prevent coronary complications. Toxic shock syndrome, caused by bacterial toxins from Staphylococcus aureus or Streptococcus pyogenes, can produce strawberry tongue along with high fever, hypotension, diffuse rash, and multi-organ dysfunction. This represents a medical emergency requiring intensive care, aggressive fluid resuscitation, and broad-spectrum antibiotics. Additionally, severe vitamin B3 niacin deficiency causes bright red, painful tongue as part of pellagra. The tongue becomes beefy red, swollen, and extremely painful, interfering with eating and speaking. If you or your child develops bright red strawberry tongue, especially with fever, rash, or other systemic symptoms, seek immediate medical evaluation. These conditions require urgent intervention to prevent life-threatening complications. Your tongue is an extraordinary diagnostic tool that reflects your entire body's health status. The 5 signs we've discussed: geographic tongue suggesting inflammatory conditions or deficiencies, black hairy tongue indicating dysbiosis or GERD, smooth red tongue warning of B12 or iron deficiency, white patches signaling pre-malignant changes, and strawberry tongue indicating serious infections all provide critical early warnings. But here are additional quick signs experienced clinicians assess. A severely fissured tongue suggests dehydration or Sjogren's syndrome. A deviated tongue, when protruded, indicates hypoglossal nerve damage or stroke. Tremor suggests hyperthyroidism, Parkinson's disease, or alcohol withdrawal. And pale tongue indicates anemia. The key is self-awareness. Examine your tongue regularly in good lighting. Note its color, texture, coating, and symmetry. Photograph any concerning changes to track progression. Your tongue often reveals problems months before blood tests or imaging detect them. Don't ignore its warnings. Geographic patterns, unusual colors, persistent patches, or texture changes all deserve medical evaluation. Remember, your mouth is an extension of your entire body. What appears on your tongue reflects what's happening systemically. Early detection transforms outcomes dramatically. What surprised you most about tongue diagnosis? Have you noticed any of these changes? Share your experiences in the comments. If this video provided valuable insights, subscribe for more evidence-based medical content that empowers you to understand your body's warning signs. Your tongue is talking. Are you listening?